Meet Petra, who has been working as a nurse for over 25 years in a busy public hospital. Petra has worked in different nursing roles and still has a passion for nursing. Petra is dedicated to delivering care to her patients and has successfully completed postgraduate studies in the specialty where she works. She is seen by her colleagues as an expert in her field of nursing and serves as a mentor to other nurses newer to the profession. Petra thrives on her ability to make a real difference in her patients' experiences and lives. Petra is keen to learn new skills and develop her abilities to meet the challenges of everyday practice and the challenges that present themselves in an increasingly complex healthcare system. Petra has noticed significant changes in the way the healthcare systems work over the past 25 years, some good and some not so good. Things today seem much busier and faster paced than they were when she first started nursing. Early in her career, there seemed to be more time to spend with patients and really get to understand their needs and provide the care they required. Petra was not as confident about how to manage complex scenarios and challenging situations back in those days, and relied on other more experienced staff to help her and to learn from. Petra also spent more time checking the platform that had all the hospital policies and procedures back then. She was very careful to follow those policies closely, as she was worried about making mistakes and risking patient safety. Over the past decade or so, Petra has noticed changes in the way she practices and cares for patients. She has started to recognize that she's much more confident in managing a wide range of challenging scenarios and patient situations. She notices that others look to her for help in managing those challenges and often ask her for help and advice. The way she assessed the needs of her patients has changed too. She used to use the assessment tools to identify the patient's needs, but now she is able to assess those needs quickly without using those tools, and then document the risk and patient assessment in the online medical record. This way of working seems to make sense to her and feels more natural. She also feels much more confident that she knows how to manage challenging situations without needing to refer to the policies as much, and has noticed that she changes or adapts how she manages situations, sometimes outside of exactly what the policies and procedures suggest. She sometimes worries that she should not be doing that, but it seems to work effectively and results in good and safe outcomes for her and the patients. She has developed a strong sense of pride in her ability to adapt to situations and ensure good outcomes across her career. She likes to contribute back to the profession by helping nurses, newer to the profession, in how to develop those same abilities and ways of working. Even though Petra feels more confident in managing difficult patient care and assessment, the time it takes to complete all the required documentation and other reporting regulations has started to really frustrate her. More and more, she finds her time on each shift devoted to entering details into the electronic medical record, spending more time on the computer and less time with her patients. She understands the need to make sure that the assessments and care she delivers is documented, but there seems to be more and more requirements that she does not believe contributes to making care better for her patients. She notices that most of her colleagues share this frustration and that it has become overwhelming, making it hard to give the patients the care that she believes they need. New requirements and ways of working seem to be passed down from management constantly, and the value of those changes are often difficult for her and others to see. "We never stopped doing anything. It's always adding things to our role," she complained one day during handover. Increasingly, her colleagues sense a disconnect between what they are required to do every day and what is realistically achievable. She discussed these issues with her colleagues one day and said, to be able to manage all those documentation requirements, we have to cut back on the time and attention to direct patient care. Often changes are implemented that require additional documentation that repeat other documentation practices that we already do. So now we have to document the same thing in 2 places. Or other times the requirements do not seem to make sense or be coordinated with other changes that have been implemented previously. All these requirements start to add up, create pressure, and seem overwhelming. She recognises when there are things going wrong on the ward or in the hospital, like an increase in adverse events, that management need to make changes to improve those problems, but the changes seem to come from above and don't seem to really understand the cause of those problems or what is likely to make those problems better. It's like the people making those changes don't really understand what we do here on the ward or how things work every day. The hospital is much busier than it ever used to be. There are always problems being able to admit people from the emergency department and no available beds. Petra says that there is always pressure for us to be more efficient, move people out of hospital, or care for people in our treatment rooms, etc. But I feel like we are at the end of our ability to manage those changes and need some way to lighten our load so we can manage these challenges. It's becoming very hard to keep positive, and some days I dread going to work. We need someone to look closely and say, we know it's challenging, let's try to make things easier for you, and actually ask us what we need to do that. There are lots of things we do in our daily practices that could be done differently or not at all, that would free up a lot of time for us to focus our care back onto our patients.
Petra's story is used here to demonstrate how clinicians working in healthcare today may perceive the way they are guided to practice and how decisions made about systems of care are experienced locally. The story also reflects how the way Petra's practice over time has changed, especially as she has developed more skills and confidence that has led to her practicing at an expert level. While the perceptions of those delivering care are vital to identify, there are other considerations at the institutional levels that must also be considered. What is important here is a recognition that the priorities of the institution tend to be disproportionately used to guide practice requirements in healthcare. As the complexity of healthcare system grows, there is a risk that the perspective of clinicians is lost and the impact of practice requirements fails to be recognised. Within the complex world of healthcare, it is unreasonable to expect that the policies and procedures created to guide practice can be used to address every clinical scenario faced locally. In real-world practice, clinicians adapt every day to different scenarios, challenges, and resources. While they tend to work within the policies and procedures of that institution, it is their ability to adapt that contributes to safe outcomes. In the past, healthcare systems have tried to limit adaptations in practice, seeing it as increasing risk. But in reality, those adaptations are what keep people and outcomes safe in the vast majority of cases. As the complexity of healthcare grows, many of the activities and ways of working we ask clinicians to do are intended to lower risk, but they've created a type of safety clutter where some of those actions actually increase the risks they are intended to prevent, resulting in unintended consequences. The amount of time it can take clinicians to document justifications for their care has begun to reprioritize their focus and resources, so they tend to prioritize documentation requirements rather than implementing care. They often sense a tension between wanting more capacity to deliver care rather than spend time engaging with documentation and computers, but struggle with how to shift that balance. There is value in engaging with clinicians and reimagining how we ask them to work, document, and deliver care, and identify how we can change the requirements to give them back capacity to deliver care in a way that makes sense to them,
while still balancing institutional requirements.